Approximately 2% of adult men and 9% of adult women in the United States have iron deficiency, and it is the most common cause of anemia in this country. Iron, a vital mineral found abundantly on Earth, plays a crucial role in our body, particularly in the formation of hemoglobin, a component of red blood cells. The consequences of iron deficiency are not to be underestimated. It may impair cognitive function, decrease immunity, and diminish overall vitality. In severe cases, it may even lead to complications during pregnancy and developmental issues in children. It's a condition that may silently creep up, often going unnoticed due to its subtle symptoms. Hence, understanding and recognizing the early signs of iron deficiency is a crucial step in taking control of our health and well-being. Today, we're diving deep into the 12 subtle symptoms of iron deficiency that you should be aware of. 1. Unusual tiredness. Muscles and tissues depend heavily on oxygen for energy production. They use oxygen to convert nutrients from our diet into energy, a process known as cellular respiration. When the body is low on iron, it struggles to produce enough healthy red blood cells and, consequently, enough hemoglobin. With less hemoglobin available to carry oxygen, your muscles and tissues receive less of the oxygen they need. This leads to a decrease in energy production in these cells, resulting in the feeling of fatigue or tiredness, a common symptom of iron deficiency. This fatigue is not just a general feeling of sleepiness, but a profound exhaustion that isn't relieved by rest, significantly impacting day-to-day activities and overall quality of life. According to a study comprising 14,762 young, 18 to 23 years, and 14,072 mid-aged, 45 to 50 years, women over a span of 2 years, iron deficiency is associated with decreased general health and well-being and increased fatigue. 2. Paleness. The skin receives its coloration partly from the blood flowing through the vessels close to its surface. With fewer red blood cells and less hemoglobin, the blood loses some of its vivid red color, becoming more dilute. This change is often most visible in areas where the skin is thinner, such as the lower eyelids, gums, and nails, making the skin in these areas appear paler than usual. A 2016 study notes that pallor in the skin or inside the eyelids is a reliable indicator of anemia. A person with severe anemia may also have pallor in the creases of the palms of the hands. 3. Shortness of breath. Do you feel tired more easily? Does taking only a few steps make you go breathless? Iron is a key component in the production of hemoglobin, the protein in red blood cells responsible for carrying oxygen from the lungs to the rest of the body. With lower hemoglobin levels, the capacity of the blood to carry oxygen diminishes. This means that even though your lungs are functioning normally, the rest of your body receives less oxygen than it needs. In response to this oxygen shortfall, the body tries to compensate by increasing its heart rate and respiratory rate to enhance oxygen delivery to tissues and organs. This results in faster and more shallow breathing, or shortness of breath. According to a study, a 38-year-old woman with increasing fatigue and shortness of breath was found to be low in iron. When the condition worsened, even minimal exertion caused her to become short of breath. It indicates that you should always check your iron level if you get tired easily. Do you find this information helpful? Don't forget to hit the subscribe button and ring the bell icon for more health secrets and tips. 4. Heart palpitations. In anemic conditions, since there's less hemoglobin available to transport oxygen, the oxygen levels in the blood decrease. The body, recognizing this reduction, responds by trying to increase oxygen delivery to tissues and organs. To do this, your heart works harder and pumps more blood. The heart does this by pumping more blood with each beat, beating faster, holding more blood, and making it easier for blood to flow. This increased workload may lead to an increased heart rate and sometimes an irregular heartbeat, as the heart is working harder and faster than usual. This heightened cardiac activity is perceived as heart palpitations, a feeling that the heart is beating too hard or too fast, skipping a beat, or fluttering. These palpitations may be more pronounced during physical activities or stress, as these conditions naturally increase the body's demand for oxygen, further taxing an already overburdened system in individuals with iron deficiency anemia. 5. Dry and damaged hair and skin. Oxygen is vital for various cellular functions in the skin, including the synthesis of collagen, a protein that keeps skin supple and firm. A lack of adequate oxygen may slow down these processes, leading to drier, less resilient skin. Additionally, iron is involved in the process of cell turnover and renewal, and a deficiency may result in a slower replacement of old skin cells, contributing to a lackluster complexion. Regarding hair health, each hair follicle requires a sufficient supply of nutrients and oxygen to grow. Iron deficiency may disrupt this supply, leading to weakened hair structure. Due to the body's preference for protecting vital organs over hair growth, in times of nutrient scarcity, hair follicles are among the first tissues to suffer from nutritional deficiencies. Research potentially suggests that a low level of iron is linked with non-scarring hair loss conditions like alopecia areata, androgenetic alopecia, telogen effluvium, and diffuse hair loss, primarily in women. 6. Poor oral health. Normally, the tongue has tiny, finger-like projections called papillae. In cases of iron deficiency, these papillae may become swollen or inflamed, or they may even reduce and flatten out, leading to what is described as a smooth or bald tongue. This change may make the tongue appear unusually smooth and may sometimes cause discomfort or pain, especially when eating hot, cold, or spicy foods. A study found that iron deficiency may promote dental caries because it may lead to an early eruption of deciduous teeth with a negative impact on the enamel. Additionally, iron plays a role in maintaining healthy mucosal tissues, including those in the mouth. A deficiency may disrupt the integrity of these tissues, leading to angular cheilitis, a condition characterized by inflammation, redness, and soreness in the corners of the mouth. These areas might develop cracks or fissures, and in some cases, open sores or ulcers may form. 7. Restless legs. Do you know that people with iron deficiency anemia are 6 times more likely to have restless leg syndrome than the general population? In individuals with iron deficiency, the decreased level of iron in the blood affects the availability of iron in the brain. This reduction may lead to alterations in dopamine signaling, a neurotransmitter that plays a key role in controlling muscle movement, potentially triggering the symptoms of restless leg syndrome. People with restless leg syndrome often describe the sensations in their legs as crawling, creeping, pulling, or throbbing, which creates an almost irresistible urge to move the legs in an attempt to relieve these feelings. 8. brittle or spoon-shaped nails. In the initial stages of iron deficiency, the nails may start to show signs of brittleness. They may become weaker, more prone to chipping and cracking, and may lose their luster. This change in nail strength and texture is primarily due to the reduced oxygen supply to the nail beds. As iron deficiency progresses, the shape of the nails may undergo more noticeable changes. The nails may begin to concave or become spoon-shaped, a condition termed koilonychia. In this condition, the nails become thin and the edges may turn upwards, creating a depression in the center of the nail that may hold a drop of liquid. This distinctive change in nail shape is more commonly observed in severe cases of iron deficiency. 9. Frequent infections. Iron's role in the immune system is pivotal, and its deficiency may compromise the body's ability to fight off infections. T cells, a type of white blood cell, play a critical role in orchestrating the body's immune response to pathogens. Iron deficiency may hinder the proliferation and function of these cells, weakening the body's adaptive immune response. In addition to that, iron is crucial for producing reactive oxygen species within another type of immune cell, macrophages, a process used to kill pathogens. When iron levels are low, the effectiveness of macrophages in destroying pathogens is reduced. Moreover, iron is involved in the production of cytokines, molecules that are vital for communication between cells during an immune response. Iron deficiency may alter cytokine production, affecting the body's ability to signal and coordinate an immune response. A prospective study found that patients with low preoperative serum ferritin levels, which indicated low iron stores, experienced more postoperative complications, particularly infections, after abdominal surgery. 10. Poor appetite. In infants and children who are in crucial stages of growth and development, iron is essential not just for creating hemoglobin, but also for overall growth and brain development. When they are iron deficient, their bodies might not grow at a normal rate, and they might experience developmental delays, which may include a reduced interest in eating. In adults, iron deficiency may affect the body's metabolism. Iron plays a role in many enzymatic processes that are crucial for converting food into energy. When iron levels are low, these processes become less efficient, potentially leading to decreased energy levels. This reduction in metabolic efficiency may indirectly affect appetite. Furthermore, iron deficiency may sometimes cause nausea or discomfort in the digestive system, which may also lead to a decreased desire to eat. In a study lasting 14 weeks, 87 primary school children taking 150 milligrams of sustained-release ferrous sulfate daily showed improved growth and appetite, with a notable 10% increase in energy intake from snacks. 11. Anxiety. The link between iron deficiency and increased anxiety levels is an area of growing interest, highlighting the complex relationship between nutritional status and mental health. The brain is highly sensitive to changes in oxygen levels. Adequate oxygen is necessary for the brain's energy metabolism and for maintaining normal neurological function. When the brain receives less oxygen due to iron deficiency, it may affect its functioning, potentially leading to symptoms like fatigue, sluggish cognitive function, and mood disturbances, including increased anxiety. Several studies say that iron deficiency in infants may lead to behavioral tendencies that affect confidence, social interactions, and anxiety. Moreover, iron deficiency may disrupt the optimal production and functioning of neurotransmitters such as dopamine and serotonin. Imbalances in these neurotransmitters may contribute to feelings of anxiety. 12. Cravings for non-food substances. Pica, characterized by cravings for non-nutritive substances like dirt, ice, or clay, is indeed a common and peculiar symptom of iron deficiency, particularly observed in women and children. The exact cause of pica is not fully understood, but several theories suggest that the craving for non-nutritive substances might be the body's attempt to obtain missing nutrients, like iron. However, the substances craved in pica typically do not provide the needed iron, and consuming them may be harmful and may even exacerbate the deficiency by interfering with the absorption of nutrients. In most cases, where pica is associated with iron deficiency, the unusual eating behaviors tend to diminish or disappear following supplementation with iron. Who is at the highest risk of low iron? Although these are the most common signs of iron deficiency, many people suffering from low iron don't experience any signs at all. That's why you must be aware of who is at high risk of iron deficiency. 1. Women of childbearing age. Due to menstruation, women who have periods are at a higher risk, especially if they experience heavy menstrual bleeding. 2. Pregnant women. Increased blood volume during pregnancy and the iron demands of the growing fetus elevate the risk of iron deficiency. 3. Infants and young children. Rapid growth rates require more iron, which might not be met solely by their diet. 4. Vegetarians and vegans. Since the body absorbs iron from plant sources less efficiently than from meat, those following a plant-based diet are at a higher risk. 5. Frequent blood donors. Regular blood donations may deplete iron stores in the body. 6. People with gastrointestinal disorders. Conditions like celiac disease, Crohn's disease, or ulcerative colitis may lead to poor iron absorption. What is the daily recommended value of iron? The recommended daily intake of iron is about 8 milligrams for adult men and postmenopausal women and 18 milligrams for premenopausal women, with pregnant women requiring about 27 milligrams. Remember, the absorption of plant-based, non-heme iron is enhanced by vitamin C, while animal-based, heme, iron is generally absorbed more efficiently. What are the popular foods rich in iron? Now that you already know how much iron you should take daily, you also need to find iron-rich foods to add to your diet. Spinach, which contains about 4 milligrams of iron per 100 grams, and lentils, which contain around 3 milligrams per 100 grams, are great for combating general fatigue, weakness, and restless leg syndrome. Red meat, which contains about 3 milligrams of iron per 100 grams, is helpful in improving skin pallor and alleviating heart palpitations. Pumpkin seeds, which contain about 9 milligrams of iron per 100 grams, and dark chocolate, which contains around 17 milligrams of iron per 100 grams, are excellent for improving mood and reducing anxiety, while also stimulating appetite. Tofu, with 5 milligrams of iron per 100 grams, is beneficial for healthy skin and hair and maintaining oral health. Chicken liver, which contains about 9 milligrams of iron per 100 grams, and fortified breakfast cereals can be the keys to boosting the immune system and managing symptoms like pale skin and fatigue. Oysters, with around 5 milligrams of iron per 85 grams, can be effective in stimulating appetite. Being aware of the 12 warning signs of iron deficiency is crucial to recognizing this often overlooked health issue, from unusual tiredness to more severe symptoms like heart palpitations and restless legs. Each sign is a potential indicator that your body is signaling for help. It's essential to take these signs seriously and not self-diagnose. Consulting with a healthcare professional is the best course of action. They may provide accurate diagnoses and appropriate treatments, ensuring that your iron levels are restored and your health is safeguarded. Now that we have discussed the many signs of iron deficiency, there are always other signs of health we should look out for, from kidneys to pancreas. Interested in learning more? Watch. Save your kidneys from damage by eating these 13 foods. Or watch. 9 foods to save your pancreas from damage. Watch 1, or even better, watch both. What are the other signs you know that may indicate iron deficiency? Let us know in the comments below.